Our topic for today is first part of biomechanics of wrist joint. The wrist joint is made up of the distal end of radius and ulna, that as you can see here, that articulates with the carpal bones, the proximal row of carpal bones. There are 4 proximal carpal bones, 4 distal carpal bones, 5 metacarpals, and then the phalanges, the proximal phalanges, middle phalanx, and the distal phalanx. The wrist joint complex consists of 5 joints. The first is the radiocarpal joint. As you can see here, the radius and ulna articulates with the proximal row of the carpal bones. Mid-carpal joints, the joint between the proximal and the distal row of carpal bones. Carpo-metacarpal joint of thumb and fingers, the joint between the carpals and the metacarpals. Metacarpophalangeal joint, the joint between the metacarpals and the phalanges. And interphalangeal joint, the joint in between the phalanx. In today's video, we will be discussing about the first joint, that is the radiocarpal joint structure. As you can see, the radius and the ulna articulates with the proximal row of carpal bones that consist of scaphoid, lunate, and triquetrum. The lateral radial facet, as you can see, the lateral radial facet will articulate with the scaphoid. The medial radial facet will be articulating with the lunate. The triangular fibrocartilage, this articular disc, will articulate predominantly with the triquetrum. Always remember that the ulna is not in direct contact with the proximal row of carpal bones. Now, this articular disc is known as triangular fibrocartilage complex. It is of an utmost importance. As you can see, this is a triangular fibrocartilaginous complex. It is formed by the articular disc that binds the ulna and radius together. As you can see in this, it is a binding agent between the radius and the ulna. Also, it binds the radio-ulnar and ulnocarpal ligaments together. As you can see, this is the radio-ulnar, which is bounded by to the articular disc. This is dorsal radio-ulnar. Okay, these are the ligaments of the wrist complex. This is the lunate triquetrum. Now, moving on, the vascular supply of the wrist joint is from the branches. As you can see here, from the branches, the deep palmar, here you can see that there is a deep palmar arch, right? And the wrist joint gets its blood supply from the palmar carpal arches, which are surrounded or which are derived from the ulnar. As you can see, the red portion, this is the ulnar artery and the radial artery and its branches forming the digital artery and common digital artery. The nerve supply. The innervations of the wrist joint is derived by the branches of median nerve, radial nerve, and the ulnar nerve. Right, the branches of these nerves, the anterior branch of the median nerve, the anterior interosseous branch, posterior interosseous branch of the radial nerve, and deep and dorsal branches of the ulnar nerve supplies the wrist joint. The joint capsule. The joint capsule is an important structure in the wrist joint. It is double layered like any other synovial joint. The outer layer attaches to the distal end of the radius, ulna, and proximal row of carpal bones. The inner layer, that is the synovial membrane, it extends up to the margins of the articulating surfaces. Now, there are 2 typical terms which is known as ulnar negative variance and ulnar positive variance. Ulnar negative variance is when the ulna is comparatively shorter than the radius at its distal end. Ulnar positive variance is when the ulna is longer at its distal end than the radius. This is important for weight bearing considerations and appropriate distribution of the load. Then we have radiocarpal capsule and ligament. This is strong but somewhat loose, and it is reinforced by capsular and intercapsular ligaments. Most of the muscles and ligaments crossing the radiocarpal joint are also responsible for the stability of the midcarpal joint. The flexor carpi ulnaris is the only muscle that crosses the radiocarpal joint and attaches to any of the bones of the proximal carpal row. So this comes to an end of the first part of biomechanics of the wrist joint. Thank you.